Hey there. Ever had back pain? What about sciatic pain? Sciatica. That's nasty. I have. I'm Dr. Rob Mabry. I'm a chiropractor. I found out about chiropractic through my athletic history. I grew up a multi-sport dude. I played junior college football and baseball, and I found cycling. I rode a bicycle from Seattle, Washington to Memphis, Tennessee, and then I started racing on the U.S. Pro-Am road circuit. I raced in Italy in 1986. I was in my mid-20s and I was in the best shape of my life, and my dream was to get a job on a pro cycling team. I'd never had any back pain at all, zero. I grew up in a gym and a weight room, and just like I'm standing here with you, I bent over and I could not stand up straight, and I had immediate burning, nasty sciatic pain down the back of my right leg into the ball of my right foot. Somebody said, go see a chiropractor. I didn't know anything about chiropractors. I went, the doc took an x-ray and he showed me that I had pelvic rotation and tilting, and worse, I had 90% disc loss at L5S1. And I was freaked out, like, why? How? And he said, wear and tear. That didn't mean a whole lot to me. But after a few visits, he got me out of pain, and that meant a lot to me, and I was back training again. You see, I'd made a mistake that we all make prior to the incident in assuming that if I don't have a symptom, I don't have a problem. And I didn't have a symptom, but I had a big underlying problem. The pelvic rotation and tilting was there for who knows how long. After he got me out of pain, I made the same assumption. If I don't have a symptom, then I'm fully healed. And my right sciatic nerve wasn't fully healed yet. And I was back going at it as hard as I could. Well, my left leg took over on my bike, and my form got so bad that I got twisted, and my teammates were like, dude, it's ugly. You need to get off. I struggled for like 3 or 4 more years to come back around, but I just couldn't, and it forced me out of the sport. But it motivated me to become a chiropractor. So fast forward, I'm in practice, and patients are coming in, and they've got the same questions that I did. Regardless of their problem, they wanted to know, why did I get this, and how do I never get it again? So turns out Doc was right. It's wear and tear, but it's why do we get the wear and tear? Wear and tear is equal to ADLs, or activities of daily living. These are the things that we're doing in our lives every single day, and they're cumulative. I used to say repetitive postures become permanent postures. Neoplastic remodeling, new plastic, connective tissue, muscle, tendon, ligament, fascia. Those things mold themselves to become whatever the form that whatever it is we're doing on a daily basis. You could also look at that as a biomechanical pattern. We all have one. If you have, based on the accumulation of our ADLs, I call it the equation for pain. I boiled it down to 3 basic causes, 3 fundamental causes, and that produce 3 things: repetitive stress, mechanical stress, doing the same activity over and over and over and over. Repetitive posture, those can go together. You can have a repetitive posture while you're doing your repetitive stress. And a history of trauma. Trauma takes on many variables. There's micro trauma. I tripped and almost fell. There's macro trauma. I got hit by a Mack truck. And then there's everything in between. And all these things are accumulative. They're cumulative. They produce 3 things: joint dysfunction or fixation, complicated by neuroconnective tissue compensation. I used to say muscular compensation or guarding, but it's more complex than that. It's what we already said: muscle, tendon, ligament, fascia. They're all part of it. And neuro is nerve. Your nervous system is involved. They cause static load. What is static load and why is it important? Static load is physics. If every joint in my spine, or in my body for that matter, has full range of motion, then my load on that joint from me is going away. Load dispersion. If I get joint fixation or dysfunction based on the accumulation of day-to-day wear and tear, developing a dysfunctional biomechanical pattern, and I lose joint mobility, my load on me gets static. That can not only cause inflammation, But relative to the spine and the disc, remember he said I had 90% disc loss in my 20s. The most valuable thing that I learned in 4.5 years of chiropractic school, for me personally, was disc health. How do we maintain it? The only way the disc maintains its thickness and its flexibility, the disc is a shock absorber. It's a little bushing in between each vertebra, and it's a spacer. The disc height allows the bone above and below to maintain a nice healthy hole for the nerve root to exit. If my disc gets thin, the bones get closer together, the hole narrows, and it pinches off the nerve. Sciatica. Okay, so if I develop joint fixation in my spine due to pelvic rotation, torquing, tilting, and pinching, then those vertebra, the low vertebra, are not moving properly, and that disc is not hydrating. The joint movement and the vertebra moving on each other allows the disc to pull in moisture. It maintains its thickness through hydration. That was critical to me, and that's why I lost my disc space at an early age. So it kind of shifted my philosophy and why I was in practice. Now I considered myself an optimal biomechanical pattern improver, right? My job was to optimize biomechanical patterns, because every patient that was presenting into my office had the same pattern, both men and women, all shapes and sizes. They had a right short leg, a left long leg. Their pelvis was rotated forward on the right, drawing the right leg short, tilted backward on the left, pushing the left leg long. They had, just like that, the right short leg, left long leg, right rotated pelvis, left rotated backward pelvis. They had, this is a picture of a patient of mine. He's face down on the table. This guy works out 3 to 5 times a week. And he's not an elite endurance athlete, but he's super fit and is a huge outdoorsman. You can see his right hip is higher, and this is a common pattern. These muscles, these paraspinal muscles here, are flatter. You can see more of the white light, and this ridge is taller. These are, you could argue, more developed, and these are underdeveloped. That's a problem or a function of a dysfunctional pattern in gait. And I started to wonder, and everybody had this. A tilted pelvis creates a lot of problems, a lot of compensation problems. If I have a tilted pelvis, then my brain is not going to hang out over here. It's going to want to get itself centered over the sacrum. And it does so by all of that neuroconnective tissue compensation and guarding. It's going to get itself functionally back centered over the sacrum, and that's going to cause an S-curve in my spine. That's all sorts of problems. My hips are unlevel, my legs are not level, I've got an S-curve in my spine. There's all sorts of things going on with that pattern. So I started to question, why is everybody showing up with the same pattern? What is the ADL that we're all doing exactly the same that creates this? And the thing that I came up with was driving cars. We all do it around the world exactly the same. I don't care if you sit on the other side of the car or drive on the other side of the road, you drive the car the same way. And I get pushback from patients who drive manual transmissions. I learned how to drive in a manual transmission. I was driving a manual transmission when I had my incident. It's true that it's less causative or less one-sided, but when you're pressing the clutch, you're doing one exercise against one resistance in one direction. The right leg, while you're driving a car, does an exercise against two resistances. You anchor your heel in between the accelerator and the brake pedal, and you go from accelerator, brake, gas, brake, hold the gas a while, go to the brake, hold the brake a while, go to the... Research shows that it takes up to 10 pounds of pressure to depress a gas pedal, and up to 70 pounds of pressure when you brake hard. That doesn't sound like a whole lot. 70 pounds is a lot, but even 10 pounds 100 times a day 1,000 times a week, tens of thousands of times a month, over the course of your driving lifetime is enormous. So inject my neuroconnective tissue IQ phrase. That's exactly what's happening. The right side of our bodies has a higher neuroconnective tissue IQ. When you drive your car now, you don't even think about it. You're in freeway traffic and you're slightly accelerating to get around this slowpoke. You got to tap your brake a little bit because there's somebody who ain't going very fast, and you're driving your car with your foot, and you're not actually consciously telling your foot what to do. That's neuroconnective tissue IQ. And why is that a big thing? Because it takes over in your gait. The other common part of the pattern that I found was that patients have tight right hip flexors compared to the left, and tight left hamstrings compared to the right. Why is that? When you're seated in your car and you're lifting your foot and pressing your foot, that's dorsiflexion and plantar flexion against two different resistances, you're exercising connective tissue and neurology, nerve tissue, all the way into your pelvis. Okay? And over time, that becomes our pattern. And so that starts to work its way into our gait, how we walk. And you start to fire your hip flexors more on the right, and you're firing your hamstrings more on the left. And my solution to that's the motivation to Easy Skeletal Alignment Program and the Pelvic Leveler, ESAP PL. The Pelvic Leveler is a simple device that actually allows us to put a little device on our left foot and exactly mimic the same activity that we do when we're driving the car with our right. And the whole goal behind it is to raise the neuroconnective tissue IQ on the left to match that of the right. And if you do, that'll start to manifest itself in your gait, and you'll start to recruit the same connective tissue on the left that you do on the right that we're not doing now because of the dysfunctional pattern that we have. Ultimately, if we do that, if we match the neuroconnective tissue IQ on the left to the right, over time, you'll start to unwind your pelvis, reduce pelvic rotation, reduce unleveling. You will optimize your leg length. That will have a global, when you balance your pelvis, you're going to balance your overall frame. And that's why I developed ESAPPL.com.